presented in OPD with the complaint of pedal edema or generalized body swelling. If patient present with any complaint of swelling, elaborate the patient with asking about 6 questions. Number 1, ask about the site, either at the lower only, dependent on lower limb, unilateral or bilateral. Ask about the involvement of the upper limb and periorbital or face involvement. Next, ask about the duration. If onset is less than 72 hours, then underlying cause may be the infection or thrombosis, and if duration is more than 72 hours, then it may be the underlying cause systemic or other features, which we will discuss in next slide. Next, ask about the associated feature pain. If there is pain, then underlying cause may be the thrombosis or cellulitis or venous ulcer. Ask about the variability of the edema, either it is persistent or aggravated or relieved with relieving factors. If swelling is persistent throughout day and night, and underlying cause is the likely hypoalbuminemia. If the patient does give history of variability, edema settle down at night, then underlying cause may be heart failure, venous ulcer, venous insufficiency, and idiopathic edema. Number 5, ask about the systemic features. There are 3 main organs which are involved in the pathogenesis of edema. Number 1 is the heart. Ask about the feature of symptoms of heart failure. Number 1, chest pain, shortness of breath on exertion, orthopnea, PND. And ask about the feature of cirrhosis, risk factor of cirrhosis or the hepatitis, viral hepatitis C, chronic hepatitis C, and ask about the chronic alcohol, prolonged use of alcohol intake. Ask about the abdominal distension, jaundice, hematemesis, melena, and other feature of liver disease. Then ask about the feature of nephrotic syndrome. A third organ is the renal, and in the renal is the nephrotic syndrome is the most common cause of generalized body swelling and anasarca. Ask about the frothy urine and periorbital puffiness early in the morning. These 2 are the hallmark feature of nephrotic syndrome. Number 6 is a very important and common cause of pedal edema in our society. That is the history of medications. There are some medications which are involved in generalized body swelling. Now we go to that in detail. The first question is the site and duration. If they ask about swelling is in one leg or both legs. If swelling is unilateral, then underlying cause will be the cellulitis, DVT, compartment syndrome, or filariasis or lymphedema. If swelling is bilateral and duration is prolonged, more than 72 hours, then underlying cause will be systemic illness. Systemic illness involved is the DVT, bilateral DVT, chronic heart failure, nephrotic syndrome, malabsorption leading to hypoalbuminemia and cirrhosis. Association of the pain. If the swelling is painful, then is the most likely cause will be the DVT, cellulitis, and if the painless, then heart failure, renal failure, nephrotic syndrome, and cirrhosis. Then the duration of illness, it is very important. If duration is short, less than 72 hours, then cellulitis, DVT, compartment syndrome. If the duration is more than 72 hours, then underlying cause may be the systemic illness. Already we have discussed. These are the cirrhosis, heart failure, drug-induced, and no variability of edema. If edema settle down at night and increase on standing, then underlying cause will be venous insufficiency, heart failure, and idiopathic. If edema, as we already discussed, if edema of heart failure and venous insufficiency disappear on lying down. Next is the history of the systemic illness. First organ is the heart failure. Heart, elaborate with chest pain, shortness of breath, orthopnea, and PND. That is the feature of congestive chronic heart failure. Number 2, the nephrotic syndrome. Number 3 is the cirrhosis. Number 4, very important organ also involved in body swelling is the hypothyroid. Ask about the cold intolerance, voice changes, and constipations. These are the hallmark feature of hypothyroidism. So the very important, always ask about the medication history. So many patients are on medications, and due to the side effect or adverse effect of these medication, patient develop the body swelling. Number 1, most common medication which are responsible for pedal edema is the antihypertensive, the calcium channel blocker. The most common cause of generalized body swelling or pedal edema. Beta blocker and methyl dopa also can cause pedal edema. Hormone therapy, oral contraceptive pill, these are also cause pedal edema, and use of steroids, they also cause body swelling. Antidepressant, the MU inhibitors, very common, NSAIDs, brufen, diclofenac sodium, ibuprofen, these are commonly over-the-counter used medications and can cause pedal edema, leg swelling. So Anti-diabetics, some oral hypoglycemic, pioglitazone and rosiglitazone, they are also cause body swelling. So always rule out these medications if patient presenting to you with pedal edema. Next is the miscellaneous causes. Sometimes a patient can present with obstructive sleep apnea with pedal edema. So ask about the daytime sleepiness or sleep snoring to rule out the obstructive sleep apnea. Diagnosis of the exclusion, sometimes all causes biochemical and history taking. There may be the underlying cause of idiopathic edema. Idiopathic edema is the edema in which there are no cause found, usually common in postmenopause female. Do the examination. Focus the examination on, first of all, do the vital general physical examinations. Do the local examination by examine the skin texture, redness and tenderness to rule out the local sign of inflammation. If there are local sign of inflammation, then most likely cause of inflammation is the cellulitis. Know that. Also check the extent of the swelling. See the both limbs, upper limb and face, JVP. Then see all the three most important organs in which fluid cavities in which fluid can be accumulated. These are the pericardial fluid, pericardium examination of the abdominal cavity, rule out the ascites, and number 3 is the examination of the pulmonary system and rule out the pleural effusion. If there is generalized body swelling with pleural effusion, pericardial effusion and ascites, then the underlying cause will be the hypoalbuminemia. Most common cause is the nephrotic syndrome or anasarca. Sometimes renal failure or heart failure can cause, but less likely. So examine all three cavities for fluid accumulation and see the underlying cause of the pedal edema. Next is the examine for hypothyroidism. Check the reflexes and the texture of the skin. Skin will be the thick and coarse, dry, and the ankle reflex will be absent. In chronic insufficiency, there will be hemostatic deposition, causes brawny skin commonly over the medial malleolus, and this is secondary to varicose vein. And obviously, if edema is pitting, then non-pitting, then there are think about lymphedema and hypothyroid. These are the two most common causes of non-pitting edema, and rest of the all causes we discussed are responsible for pitting edema. Next, investigation. How to investigate the patient? Investigate the patient with all baseline investigation, especially biochemical profile and CBC to rule out the infection. Urine complete for proteinuria, LFT for serum albumin, renal function, urea and creatinine, and do the lipid profile. Nephrotic syndrome, for nephrotic syndrome, if you are thinking about nephrotic syndrome, maybe the hyperlipidemia, and do the chest X-ray, ECG and pro-BNP and echocardiography for heart failure. And if acutely patient present with the leg swelling, 1 or 2 leg swelling, then do the D-dimer to rule out the underlying DVT and take Doppler. And do the viral serology for hepatitis B and C to rule out the underlying cause of cirrhosis, and also do the thyroid, free T4 and TSH. Very important if non-pitting edema and bilateral or unilateral, and all investigation thyroid, patient is euthyroid, then do the lymphoscintigraphy for the diagnosis of lymphedema. Next is the treatment of the heart failure, treatment of the pedal edema. Treatment of treat the underlying cause as heart failure, renal failure, chronic liver disease, and they are well response to fluid restriction, salt restriction, limb elevation, and they are well respond to diuretics like furosemide and spironolactone. If patient is resistant to all the therapy, especially in heart failure and especially in liver failure, then give the infusion of albumin. Aldosterone antagonists are contraindicated because of risk of developing life-threatening hyperkalemia in renal failure. Treat the obstructive sleep apnea with CPAP, weight reduction, and idiopathic edema treat with spironolactone. This responds well to mineralocorticoid receptor antagonist. This spironolactone start with 25 mg and can give to up to 400 mg, but usually patient well responds to 100 mg. Thank you very much.